Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Ocular embryogenesis. So we are looking at the period of after the consumption, and we are looking at some major changes which are occurring. So we start off with 3 weeks. So here in 3 weeks, there is a formation of the optic groove. Next, we move on to the 4th week, that is after 1 month. So here we'll find that there is the optic groove is present in the 3rd week. Here there will be optic pit. So optic pit, it develops into the optic vesicle. Optic pit into the optic vesicle. Next, there is also a plate. There is a lens plate. The lens plate, it forms, and the embryonic fissure also develops. So there is presence of the embryonic fissure which is developing. So this was 3rd week and then the 4th week. Next, what happens in the 1st month? So along the 1st month, there will be the lens plate which is formed. So there was a lens plate which was formed initially. So now there is a lens pit here. So here this lens pit, it develops. So lens pit, it develops, and followed by the formation of the lens vesicle. So lens pit is present as well as the presence of lens vesicle. Next is the hyaloid vessels. So in the 1st month, there is also the hyaloid vessels which are developing. Hyaloid vessels which are developing. Next, we move on to 1.5 months. So we saw 1st month, now 1.5 months. It is the closure of the embryonic fissure. So there is closure. So 1.5 months there's a closure. In the 1st month we saw the lens pit, lens vesicle as well as the hyaloid vessels. For 1.5 months there's a closure of the embryonic fissure. So there's closure of the embryonic fissure. And there is also differentiation of the retinal pigment epithelium. So there's differentiation of the retinal pigment epithelium, RPE, and there's appearance of the eyelid folds and the nasolacrimal duct. So the eyelid folds as well as the NLD, that's nasolacrimal duct. So this was till the 1.5 months. Next, as we move, let's look at what is present in the 7th month. So here in the 7th week, not month, 7th week. So in the 7th week, there is the embryonic nucleus of the lens. So there is embryonic nucleus. So embryonic nucleus of the lens is seen. Then comes the sclera, it begins to form. Next is the formation of the sclera. So this begins to form. Next comes the migration of waves. So there is migration. So there is migration of the waves, and the migration of the waves of the neural crest. Now there are 3 waves, so there will be the wave number 1, 2 and 3. So wave number 1, it is associated with the corneal and the trabecular endothelium. So this is the corneal as well as the trabecular endothelium. Next comes the 2nd wave. So this 2nd wave is associated with the corneal stroma. Next is the 3rd wave. So this 3rd wave is associated with the iris stroma. Now we'll move on to the 3rd month. So here in the 3rd month, there is differentiation of the precursors of the rods and cones. So there is differentiation, and this will be of the precursors of the rods and cones. So the rods as well as the cones. And here the anterior chamber, it appears. So AC appears. Next is the fetal nucleus. It starts to develop. So there is also the fetal nucleus. So this fetal nucleus, it starts to develop. And also there is a sclera which condenses. So the sclera, it will condense. Next is we move on to the 4th month. So here when you're looking at the 4th month, there's a formation of the retinal vasculature. So there's formation of the retinal vasculature. This is in the 4th month and it begins to develop. Next is there is a hyaloid vessel regresses. So this hyaloid vessels, it regresses. There is a formation of the physiological optic disc cup and the lamina cribrosa. So there is formation of the physiological optic disc cup and also the lamina cribrosa. So there is also the lamina cribrosa. Next what we see is there is a canal. There is a canal of Schlemm which appears. There is a canal of Schlemm which appears and the development of the Bowman's membrane is also seen. Then what are the other things seen in the 4th month? There is a formation of the major arterial circle. So there is a major arterial circle and also the sphincter muscle of the iris. Now when we move on to the 5th month, so 5th month there is a photoreceptors which differentiate. It differentiates and there is an eyelid separation which begins. So there is an eyelid separation which begins. Then we move on to the 6th month. So here in the 6th month there is a differentiation of the dilator pupillae muscle. So differentiation of the dilator pupillae muscle. And what are the other features of the 6th month? There is a nasolacrimal duct system. It becomes patent. So there is a nasolacrimal system. This becomes patent. And next, the cones, what we see, it differentiates. So all this are part of the 6th month. Now moving on to the 7th month. In the 7th month, the rod, it differentiates. And there's a myelination of the optic nerve begins. There's myelination of the optic nerve which begins. Then let's look at the 8th month. So here in the 8th month, there's a completion of the anterior chamber angle. So the completion of the anterior chamber AC angle. And there is also the hyaloid vessels which disappear. So there is the hyaloid vessels. So this hyaloid vessels, it disappears. Now we look at the 9th month. This is the last month. So in the 9th month, there is a pupillary membrane which disappears. So PM, that's a pupillary membrane, it disappears. To learn and grow daily like this, please do subscribe.